friends, this is Dr. Abdequaem Chimthanawala. I would like to discuss a very acute case that came to me for treatment. The patient came with his mother. He was a child. He came with his mother, and when he entered the clinic, he sat on the chair. He started doing like this. Because he had lot of coryza and he had discharge from the nose and pain in the eyes. Whenever the patient does something in relation to disease, take mark of it. Now he was doing like this. He had pain in the eyes like this. And the mother told, don't do, you spoil the eyes. This was the first symptom that I saw in the patient. We'll discuss what is this symptom. Now this child, about 6 to 7 years of age, he was suffering from recurrent nose problem, recurrent coryza. And the speciality was there was coryza without discharge, that we called as dry coryza. So there was discharge from the nose, but there was no coryza. So his mother told, sir, देखो इसका नाक कितना बेहतर है, नाक पूरी clear है. That means the mother was telling, see, there is so much discharge from the nose, but the nose is absolutely dry. Again, a very important symptom. Take note of it. Second, and she says that whenever this child gets him in the morning, the coryza is very excoriating. पूरी आँख खुजाता है या लाल हो जाता है, कभी कभी ये कट्स आ जाते हैं. That means whenever in the morning the child gets up from the sleep, the coryza is excoriating, it becomes reddish upper lip, and there is sometimes cuts also. It is so excoriating and it is painful in the morning. It is so excoriating. And sometimes in the morning, if it is not excoriating, you find that he wakes up and there is lot of discharge from the nose. The whole the pill also gets discharged with the nose in the morning when he wakes up. So this was the symptom the patient was telling me. Now we have to convert this symptom into rubric form and see whether you arrive at the symptom. Don't forget that fist movement which I told you. I said something else. So she told a very, very important symptom, that is, she told whenever the child plays outside, when he comes back home, his nose becomes red. Now very, very important symptom. Nose discoloration red after exertion. Whenever if he gets this symptom, and if this symptom is very prominent, only that child is getting and nobody is getting, then it becomes a very important symptom. So you have to think about 2 remedies. Of course, the first remedy, that is ferrum, and second, you have to remember Naxomica, and of course the third remedy which I'll tell you now. So the child's mother told that whenever the child plays and comes back home, the nose becomes red. So I told, whenever in exertion only the nose becomes red, or as such also the nose becomes red. So she told, no sir, even when he is in the room and he is roaming about here and there about 5-6 times, then also his nose becomes red. So this was another symptom which the patient's mother added. I said something else. So she said, sir, when I am teaching him, or when he's talking about the alphabets, he was from whatever school he goes in the school, whenever he's talking much, or whenever he studies much at that time, whenever he speaks something, when he has to perform in school, in that children's concert and all, then also his nose becomes red. Now the patient was actually defying the redness of nose in different degrees. So this was the case in front of us. Now how will you look at the case is a very important thing. Which symptom will you take for prescription, and how will you rubricate the patient's language in rubric form. Again, if we recap the whole case, I'll again go symptom by symptom and then convert those symptoms into rubric form so that you can understand how to convert the patient's language into rubric form. The first symptom when the child came into the clinic, he was doing like this. Of course, he was boring his fist in the eyes. So if you see that remedy in eyes, it is written, wipe inclination to, boring it with fist. He wipes the eyes with his fist, and that becomes a, in fact, if you know this remedy, this symptom also prescribed, you will cure that case. So first symptom that we have to take is inclination to wipe the eyes, boring with his fist. And the second symptom is nose discharge without coryza. A very, very important symptom, my friends. Nose discharge without coryza and nose discharge excoriating in the morning. And one of the symptoms the patient told कि बहुत ज़्यादा, it takes lot of discharge comes in the morning, the whole pillow is with the discharge. That symptom you can take, no discharge, profuse or gushing flow in the morning or profuse flow in the morning. So this becomes your symptom of nose and eyes which the patient came and told us. Now about the nose, the redness. I told you redness of nose, discoloration when there is exertion. But what did the patient add? Even while in the house, he finds, he goes 3-4 times, the nose becomes red. So you can take redness of nose from slight exertion also. And then you have to remember one drug, and that is Nux vomica. If it's slight exertion, there is redness of nose, it becomes Nux vomica. But the patient added one more symptom, that whenever he's studying, speaking, talking also, the nose becomes red. So we have lots of symptoms in front of us. Inclination to wipe the eyes with fist, nose discharge without coryza, nose discharge excoriating in the morning, nose discharge profuse gushing in the morning, redness of nose, discoloration of the nose on exertion, on slight exertion, and on talking. These 6 to 7 symptoms which we have in our repertory chart, if you repetize this, one of the wonderful remedies that comes to the repertory chart, which you have also used, I have also used in practice, and that is Squilla. Yes, this is Squilla, and Squilla is a very important drug in this condition. 2 doses of Squilla, 200, and the case was solved. Such a beautiful remedy Squilla is. But I would like to add about 2-3 symptoms more of Squilla which I have seen important in the practice. The first one is dreams. There is a dreams as if the body parts are swollen. Patient को लगता है dream में कि मेरी body सूज गई है. Dreams as if the body parts are swollen. A very, very important symptom of Squilla. Second symptom, very much important of Squilla again, and that you must always remember. I have seen lot of patients. Sometimes see the patient tell you a symptom, you said होता है. It is not like that. Flatters general on touching the abdomen. मतलब if you touch the abdomen of the patient, there is passing of the flatters. A very, very rare symptom. Touching the abdomen and the flatters passes. So flatters general, touching the abdomen on. These 2 symptoms of Squilla you must remember. Dreams as if body is swollen and flatters discharge from touching the abdomen. So the nose symptoms, these 2 symptoms summarizes Squilla. A very important remedy, my friend. If you like this video, do share and subscribe.